Hey everyone, it's Gloria here with another video. I'm a junior doctor living in Ghana and I make videos around medicine, lifestyle and faith. Welcome to my side of the internet. Today we're going to have a very nice, important discussion on what really is the career path of a doctor in Ghana. Anyone who's been to medical school or any of my colleagues can attest to this further. When you're done with medical school, a very commonly asked question or a frequently asked question is, oh, what did you specialize in? And I'm like, specialize? Like, I'm just getting started. What are you talking about? So for anyone who's asked that question before, to someone who just finished medical school, that's like the last question you should be asking. And so this video is just supposed to help you to understand what really is the path. So especially for doctors in Ghana, I'm going to be speaking in relation to the path of a doctor in Ghana. Okay, let's get started. So the first thing I'm going to say is that when you want to become a doctor in Ghana, you need to go to medical school. Once you get into medical school, you are a medical student. So that is the very first path. And medical school is 6 years for most schools. So it's 6 years in Kwame Nkrumah University of Science and Technology, where I attended. It's 6 years in University of Ghana. It's 6 years in University of Development Studies in Tamale. It's 6 years in Cape Coast, University of Cape Coast. There are other newer, what should I say? How should I call them? There are newer schools that are also offering medicine as a postgraduate program. I know that Legon is doing medicine as a 4-year postgraduate program, but it's not everyone that is eligible for it. You need to have done certain courses in uni as your undergrad. But I know Legon offers a postgraduate medical course as well. I know there's also Family Health is offering a medical course as well. I'm not too sure how many years it is. And then there's another university. I'm not very sure. But the very first thing is that you're a medical student and you complete your medical education. Once you're done with that and you successfully pass all of your exams and all of the courses, the next thing or the next stage is for you to become what we call a house officer. So that's what's called house job. So you may have heard me use that term before, because that's what I currently am doing. I'm a house officer. And basically what house job is that it is a training program that is to help you enter into the medical field a bit more seamlessly. So yes, you are a doctor. So please, anyone who has finished medical school is a doctor. A house officer is a doctor, and they actually are licensed to practice as a doctor. The only thing is that your license is provisional and you are supposed to work under the supervision of a specialist. So in whatever hospital you find yourself working, there's supposed to be a specialist to oversee all of the things that you do. So it's a 2-year training program. In your first year, you're a junior house officer, and then in your second year, you're a senior house officer. There are 4 rotations that are compulsory for you to do during the 2-year program. So it's 6 months for each of the rotations. The rotations are medicine, surgery, obstetrics and gynecology, and pediatrics. So you do each of these rotations for 6 months. There are, however, exceptions to the rule, where some people do anesthesiology instead of surgery, and some people also do psychiatry instead of medicine. So these are some exceptions to the rule, but typically everyone does the 4 courses I mentioned, or the 4 rotations I mentioned earlier on. So your first year after medical school, you're a junior house officer, and then your second year after medical school, you're a senior house officer, like I am right now. Once you are done with this thing called house job, where you are under training and you're under supervision, but you are seeing patients, you are making diagnosis, you are carrying out plans, you are actually very responsible for patients. Let me make that clear. So there's a very clear distinction between being a medical student and being a house officer. There's a lot more responsibility. Honestly, it can be very overwhelming in the first couple of months, and I'll probably talk about it in a separate video. But once you have successfully completed your first year house job and your second year house job, the next thing or the next role that you'll be occupying is the role of a medical officer. So once you have completed your house job, during your house job, there are certain things that you're supposed to be doing. You actually have a logbook, and in this logbook you have certain things that you need to take off and certain cases that you need to have seen, certain procedures you need to have done on your own, observed or assisted in. And once everything is checked and done, you are a medical and you're giving your permanent license, you're now a medical officer. Once you're a medical officer, you are free to practice wherever you want to practice. So unlike in the house job role where you have to strictly practice in a government hospital and it strictly has to be under the supervision of a specialist in whatever field you are rotating through, as a medical officer, you do not need supervision. So you can work on your own. You can work in a private corporation. You can work in a public hospital. You can do whatever you want to do. The world is your oyster. As a medical officer, there are also ranks in the medical officer journey. So after a certain number of years, you're a senior medical officer, there's the principal medical officer, and so on and so forth. However, if you decide that you actually want to become a specialist and what it means to become a specialist is that you're taking a particular field in medicine and you're deciding that I want to learn everything about this field. So once you decide that you want to become a specialist, you need to start training for that, and that training is called residency training. So in Ghana, you cannot directly start residency training right after house job. You will need to have worked as a medical officer for a period of at least 1 to 3 years, because it depends on depending on where you find yourself working as a medical officer. There are certain regions that you need to work as a medical officer for a shorter time, and you may be able to enter into residency training. The other thing is also that you need to write another exam known as the primaries. What the primaries is that you write an exam that is related to the field that you want to enter into. So let's say if you want to enter into a field like pediatrics, you write your primaries in pediatrics. If you want to enter into a field like family health, you want to write your primaries in family health. Once you pass the primaries and you have fulfilled whatever other requirements in terms of number of years you should have been working for, and if there are slots available in the particular field that you want to go into, you will now start your training for specialization, which is known as residency. So that is when you say the person is called a resident. So what a resident is that the person is a doctor who is currently in specialty training, and so they're a resident in pediatrics, they're a resident in obstetrics and gynecology, they're a resident in surgery, and so on and so forth. After you are done with your residency is not, there's no specific number of years for, like it's not a one size fits all. There are certain residencies that take just 3 to 4 years. There are some that take much longer, 8 years. So depending on wherever you are, there are also exams that you need to write from time to time. But so once you are done successfully completing your residency training, you're now a specialist. So that's when you can say, okay, I have specialized in this field and I am now a specialist. Okay, so where do we start? First, from a medical student to a junior house officer, to a senior house officer, to a medical officer, to a resident, and then now a specialist. After a specialist, you can become something that is called a subspecialist. So, not to get very technical, but let's say you decided to specialize in something like internal medicine. After you are done with internal medicine, you'll be known as a physician specialist. But you may decide that, okay, I'm very, very interested in the brain, and so I want to become a neurologist. So that's a subspecialist position, and so you may need to undergo some training for a certain number of years as well before you can become a neurologist. Or let's say you want to become a nephrologist, and so on and so forth. It may take a certain number of years before you are allowed to become that, and that is a subspecialist position. The last one I'm going to be talking about is the consultant position, and it is the highest position in terms of the career path as a doctor. When you're a consultant, you're basically creme de la creme of the creme de la cremes. So with that, it's not just a matter of subspecialization. I think you need to have done certain research, you need to have written certain publications, you need to have written certain papers, you need to have contributed to the medical field. There are certain factors that are all added up before you're imputed that title of a consultant. So that is really it. That's what the career path looks like from medical student to consultancy. There's something that is said in medicine, that medicine is a marathon. Medicine is not a sprint. If you are someone who's interested in going to medical school and becoming a doctor, you should know that you're going to have to invest a lot of your time, a lot of your years, and you're not going to become a specialist at a medical school. Please stop asking people who just finished, or in fact, the crazy one is even when you're in medical school and someone asks you, oh, so what are you specializing in? And it's like, please, I'm in medical school. I'm just trying to get through medical school. I'm just trying to pass my exam and be a doctor before I can even think about specialization. So for anyone who was confused, anyone who has been confused about the terms, I hope this video helps you so that you understand when you go to a hospital and someone tells you, hi, I'm Dr. ABC and I'm the resident, you understand where exactly they are. When you go somewhere and the person tells you, I'm the house officer, you don't look down on them and say, oh, you're a house officer, you're not a doctor. That's an insult. They are very much your doctor, and they are very much involved in your, if not, they are very, very responsible. House officers, kudos to us. Okay, let me hype us, because we do a lot of work. Okay, we do a lot of work. So this is just to help you to understand that house officers, residents, all of these people are doctors. They may be undergoing certain unique training, but they are still a doctor. If you have any other questions, comments, anything that was not too clear in the video, just let me know down in the comment section, and I will reply, and I will get to you. Like I said, this video is for the career path for doctors in Ghana. Depending on where you are in the world, it may look different. In US, it's quite different to what we have here. They enter into residency training right after medical school. So let it be said that this video is for the medical training system in Ghana. If you enjoyed this video, please like it, give me a thumbs up. Don't forget to comment and subscribe as well, and hit the notification bell so that anytime I go live, you will know about my video. Okay, and if you're a new subscriber, comment down below and let me know. Let me give you a warm, hearty welcome to our side of the internet. Love you all, and see you in the next video. Bye. If that's this type of thing. Hello guys. Let me try this again.